Heart and stroke, well, those are the kinds of things that show up as we get older. Yeah, absolutely. They are age related. Why would they be age related? Well, they're more common the older you get. The chances of developing heart or stroke issues increase as you get older. Do you know why? Because it's inflammation driving it, and inflammation increases over time. And the older you are, the longer your chronic inflammation has been going on, if you have it. And the longer the inflammation has been going on, the higher the chance of developing a heart or a stroke kind of scenario in the body. Okay, so risk factors. So this is one of the interesting pieces, I think. So risk factors, but smoking is one of the biggest risk factors. So we're including vapes in this, PS. Sedentary lifestyle. If you are spending a lot of time sitting at your computer and not doing a lot of movement, then that is one of the risk factors. Poor quality diet is another big risk factor. We're addressing that today. High cholesterol, high blood pressure, type 2 diabetes diagnosis. Those are the top three risk factors that, to me, when those show up, it means it's time to start to get to work. So if you have been diagnosed with high cholesterol, high blood pressure, or if you have type 2 diabetes, it is time to start looking after things in order to reduce cardiovascular and stroke issues. So this is why. So cardiovascular disease, how it's described, it's a common comorbidity with type 2 diabetes. What does that mean? Comorbidity. It means that they often exist together. Or to me, type 2 diabetes is a major, if you have type 2 diabetes, your chances of having cardiovascular issues increases. That's the way to think about it. So type 2 diabetes, if you have type 2 diabetes, cardiovascular disease is actually a major cause of mortality. There's about a third of the people diagnosed with type 2 diabetes who will have some type of coronary or cardiovascular disease or stroke, and that is what will end their life. I know I'm being really dramatic here, but it's just to drive home the point. It takes a long time to get there, friend. Takes a long time. And it is not because you're eating candy. It is entirely because of inflammation and the stress response, I will tell you. So first things first, that's actually what we're addressing today. But the coronary artery disease, that plaque buildup, and strokes are those two biggest ways that those who have type 2 diabetes, that's how cardiovascular issues show up. Strokes and plaque buildup in the veins. So the thinning of the arteries or the thickening of the arteries so that there's less and less blood flow able to get through.